In today's world, there would be hardly very few people who have not had a scar or a tattoo in their lifetimes. Basically, scars are marks which are left after any injury. So, how can we prevent scars basically? See, the most important thing when we have an injury, to prevent scars, it is imperative or it's important to take immediate treatment. Even if it's a small scar or a small injury, if we let it heal on its own, it usually leaves a bad mark. So it is always advisable to take some treatment in case you have a cut, preferably with a plastic surgeon or a trained person who can stitch these wounds in a manner which leave minimal scar. So the next question which comes to our mind is it possible to completely remove the scars or make the scars invisible? Well, honestly, it is not possible. But in certain patients, every individual has a way of healing. And in certain patients, we have seen such nice healing that the scars become hardly noticeable. Still, by better techniques, by use of creams and lasers and such techniques, the scars can be actually made almost invisible. So the next thing is I want to talk about is tattoos. We are not, as plastic surgeons, not concerned with making tattoos, but a lot of people approach us to get their tattoos removed. There may be many reasons, like social reasons. Somebody gets selected in army or in police force, so where these tattoos are not allowed. So these patients come to us and they ask what can be done for these tattoos. Basically, there are two modalities of managing a tattoo. One is non-surgical by lasers and by chemical peels, and one is surgical. Usually lasers in certain scars or certain tattoos are quite useful, but they require a lot of sittings, usually 6 to 8 sittings and even more sittings, and that too they don't completely remove the tattoo, they make them little hazy and little lighter with period of time. There are however certain tattoos which can go almost very light, but they cannot go completely. So this is about lasers. Then the other technique is by surgical excision or surgical removal. Now this technique is useful for people. For example, somebody comes to me and says that, sir, I have my medical interview for army after 20 days and I have a tattoo and which is not allowed. So then I cannot go for lasers. So then the option for me is a surgical removal. If the scars are thin, like usually names and all, they can be easily removed with leaving a line which with time becomes lighter. But if there are big tattoos which are broader, then many times we may have to remove them and we need to put a graft also, a skin graft. So these are the two techniques, by suturing or by skin graft, wherein we can remove these tattoos. To know more about this, you can get in touch with me on Lybrate. Thank you.